Hello and welcome to Dragonfly. Here today on this Thursday morning, I am here with two people that I'd like you to meet. This is Debi Bryk, and Debi Bryk is a
board-certified holistic nutritionist.
And this is Dr. Sanford Levy, and he is
internal medicine and practicing integrative holistic functional medicine.
Yes. So I just wanted to bring them on. I've been doing a lot of focus on health, and I want to bring in more practitioners who will talk about health and wellness from a holistic point and just share some of my journey. So I met Debi. We were just trying to figure out how many years ago. She did Reiki here with me. We trained under Michelle Clark, and Daria took it with us as well many years ago. And so I've known Debi since then. And we came to see you with Serena. Serena was having some issues with stomach issues, and we went to Debi, and she did genetic testing for Serena, and then I decided to have it as well. And I'll tell you, I had no idea. You know, when I read that report, I was like, oh my gosh, and it made so much sense.
Yeah.
When you see all those different things, like I have never heard of MTHFR, right? Or histamine, all these things. So it was very helpful, and so that has really kind of moved me along my journey of figuring things out. And then a while after that, I actually met Dr. Levy at for those of you who know David Papia, who wrote the book A Grateful Soul. I was at his book signing, and another friend, Greg Gian, introduced me to Sandy and said that he had seen him as a doctor and how much he had helped him. And I was like, wait, I got to know more, because I'm all about holistic health. So I made an appointment that week, and I was able to easily, in a short time get in. And he was absolutely what I was looking for. So now this was an appointment where you're not having an exam. You're sitting at across the desk, and giving a health history and really just having a conversation.
Yeah,
and
I'll qualify that probably one person in 10 or one person in 20, I'll do some sort of a physical exam, depending on the circumstances. Somebody comes to me with fatigue, they don't have a primary, I'm going to use a chiropractor's table and do an exam, but literally it's 1 in 10 or 1 in 20 that I do any sort of an exam. But if the history indicates an exam, then I do an exam. But for the vast majority of people, it's sitting and talking. And from my perspective, in terms of the services I offer in this practice, there's no need or reason to be doing a physical exam.
Right. So that was kind of refreshing, because as healthy as I am, I have a whole slew of doctors and was having different things going on. And so it was nice to have someone that could look at everything and make suggestions. So I brought in all the supplements I was taking, and you looked at them and told me, you talked about sourcing, best places to buy. You talked about, need or, how to take them. And that was helpful. You also were helpful with that as well. And so that was really good. And after we spent an hour together, you sent me a very detailed report that outlined everything we had talked about and next steps. And that was the first time I had sat down with someone and they had actually listened to me, or looked at me as a whole person and, wanted to figure things out. So that was huge. And really, it was one visit. And another thing that has really been beneficial is you had recommended the bioidentical hormones, which you were, promoting for brain health primarily. And to me, that was really important, because my mom had dementia, and so and she was actually part of the women's health study originally. So and he actually sent me a lot of research and told me, take my time looking at that and doing my own review. And I decided that would be helpful. So I did start on a low dose, and it changed my life. In so many ways. I didn't need to see a lot of my doctors, because all the things that I was having, like heart palpitations and stuff, were related. And so I was seeing a rheumatologist, and all my joint pain went away after that. So
I'll interject a comment.
Yes.
That in terms of menopause, most everyone thinks of menopause as hot flashes and night sweats and insomnia. And those are the most common symptoms, but it's not unusual for people to experience brain fog with menopause. It's not unusual for people to experience joint pains with brain fog. A lot of what I do, most of what I do is offering empiric trials. And lots of people that I treat with hormone replacement therapy or recommend they get it from their gynecologist, it doesn't help. But fortunately, you were one of the individuals.
It was.
Where it made a huge difference.
A huge
in your
difference,
quality
and
of
so
life in areas that wouldn't have been anticipated.
No, and going into it, I had no idea that those were going to be benefits. That was a bonus to me and life
Can I say
changing.
something
Yes,
too?
yes.
I think at the time when you did the genetic testing, there was not a hormone panel on there.
Oh,
Now
now
there's a
there
hormone
is.
panel.
That's excellent.
It's unbelievable. It shows, if you're genetically predisposed to high levels of estrogen, if you can process estrogen, because there's a lot of genes that, they're the detox genes for the liver.
Yes.
Our hormones are detoxed through the liver. So
Sure.
that also can cause a buildup of hormones
Sure.
in the body. It looks at testosterone. It even looks at, some people are genetically predisposed to, they don't convert T4 to T3
Correct.
efficiently. And so many physicians will diagnose hypothyroidism, put somebody on levothyroxine, which is only T4, and they're not converting the T4, and they're only monitoring T4 and free T4 and TSH, and the person's like, I'm not feeling any better. Well, your numbers are fine, but they're not converting it. So it's so amazing. Like, really, it hits every part.
That's awesome.
Yeah.
No, I mean it's so beneficial. Let's see who's on. Hello. Hi, Michelle. Hi, Kimberly. Hi, Noah. Hi, Daria. You just walked in. So that to me was like a surprise benefit. And you had recommended, this was a start to find, a practitioner that I could work with, which is a whole nother story, getting to where I did, but finding Dr. Coggins, who has been, amazing in this whole journey. And she is coming again this Saturday to give another talk. This is her third one. And we've just helped so many people, so many women.
Just a comment about the
sure.
T4 and T3.
Yes.
And very, very often, there's different ways to approach things. I'm very much looking forward to learning more about genetic testing. I tend to do what I call a lot of empiricism. And when I get people, a lot of people come to me. 85% of people with hypothyroidism, 80%, 85%, maybe 90%, they do fine on levothyroxine. But I'm seeing the people that come in like you're describing. They say, my numbers are fine. The doctor tells me nothing is wrong, but something is wrong. And I've had people where leothyronine, prescription T3, has made them worse.
Yes.
But I've also had people where it's turned their lives around. So for me, I tend to do more empiricism at this juncture of my practice as opposed to doing the testing and say, well, let's switch you from T4 to T3. Let's see what happens. If it makes a huge difference, then I'll get blood tests and make sure that we're on the right track. But genetic testing certainly is another way of guiding whether or not to make that change.
Right.
Yeah, and again, genetics just show what you're genetically predisposed to, not if it's expressing. So they might have that gene, and they can't, they're doing okay with the conversion. So that's where getting a full thyroid panel, getting tested, is really helpful. Test don't guess type of thing. And just like when I see the genetic test, I don't, you have MTHFR, let's mega dose.
No.
I never do that.
Right.
I have seen so much improvement with dietary and lifestyle changes and just basic nutrients to start with. That's usually what I do unless I need rapid relief.
Sure.
And then I'll have them retest with their physician 3 months or more down the road, or if they're still symptomatic, and say, okay, maybe see if we need to boost anything up.
Right.
Because that can backfire, because some people, based on their genetics, and the test tells you this, they can be sensitive to the methylated Bs. They see MTHFR, so take methylfolate, and then, they take it and they feel terrible. They get anxiety, they have sleep issues, because they have a slow count gene that can cause methyl sensitivity.
Right.
And so, or they just you don't want, or they can be over methylating.
Right,
So you
right.
start very low and slow. So I'm more conservative, where I do dietary and lifestyle changes first with just basic nutrients and working on the gut health. Because
I think gut health is.
well,
is
yeah,
huge,
I mean, honestly, it's like if your gut's not healthy and you're taking a boatload of supplements, you have expensive pee. That's pretty much all you have.
That's a good
So
point,
you
right.
have to get the gut functioning so that you're absorbing your nutrients not only from your food but also from your
Sure,
supplements.
sure.
The
Yeah.
fundamental tenet of naturopathic medicine is that all disease begins in the gut.
Right.
Yes.
Final thing I wanted to mention about thyroid conditions before
Sure.
we move on is periodically I post blogs. Currently I'm in sort of a role, sometimes it's months in between, but very recently I did a blog post on thyroid because I see more patients with thyroid than anything else based on self-selection. So this blog was just sort of summarizing my most recent 10 years of experience at sort of a high level in terms of the options pharmacologically for treating thyroid disease.
Well, that's interesting. I'm going to have to look at that. Seeing Judine, she does work with thyroid as well, and that was something that she tested. Now, I have been complaining to doctors for years about being so freezing that it's painful, and like a bunch of other, symptoms. So she did do my numbers, and they were on the very low end. So she added Armor Thyroid into my routine. I have not been freezing for the first time in years, like where I'm comfortable and not like having like afternoon fatigue and stuff. So it's a very small amount, but it's been a huge improvement.
Well, I believe that it's so prevalent in our area for
Yes.
several reasons. Number one, the fluoride in the water.
Sure.
If you're drinking tap water that has fluoride, there's fluoride in the toothpaste, there's fluoride in the mouthwash, there's fluoride in the water. Fluoride will kill too much of it will kill the thyroid. The other thing too is like iodized salt.
Oh,
Like too much iodine
Yeah.
you need selenium actually turns the iodine. We need iodine,
Sure.
but we need selenium to detox the thyroid and to convert T4 to T3. So iodine helps create T4 in the thyroid, but it's selenium that creres T3. So it converts it to T3.
So all of those things are
All of
helping.
those-
But when we're at a regular doctor, they're not even thinking about any
No.
of those things. And so it really there's a like a whole picture there that you
Right.
look at.
Yeah.
And that, I think that's important.
Yeah, there's a lot of
Yeah.
things. That's why like cleaning up the diet and lifestyle has
Huge.
I had clients where they could go off of their thyroid meds.
Right.
You can
Yeah.
reverse it.
Sure.
And people think
Yeah.
you can't, but
Yeah.
it can be reversed.
Yeah. Something else I wanted to mention, is that one of the things in my family, we had a very high risk of heart disease. We had there's high cholesterol, and so Dr. Levy sent me for a calcium score. So this was a very simple test. You go to Winsong, you pay out of pocket, and it's only like $125. But that is an indicator whether you're going to be at risk for the heart disease. Well, mine, with all these risks and my cholesterol, starting to look a little bit elevated, my calcium score was a 0. And so that was such a huge relief to me. And well, other doctors will look and they'll say, oh, your cholesterol is this number, you should start a statin right away. And I'm not that person who, I like to do everything else I can first. So that was another really beneficial thing. And I've talked to so many doctors and they don't even know about that.
No,
They don't
can
even
I say
know.
something about
Yes.
cholesterol? Because
Yes.
this is like one of my favorite topics to talk about. Because it's so, the basic lipid panel is so antiquated.
It is.
Number one, there's 3 sizes of LDL cholesterol.
Right.
There's big fluffy LDL, there's medium, and there's small dense. It's only the small dense that's problematic. The other thing is over the years, the decades, they've lowered the total cholesterol number.
Sure.
It used to be 350 was
Right,
normal.
right.
The important numbers are not only your LDL particle size, which doctors don't
They
usually
don't check.
test for.
No, but they can check.
Right, they can check. That calcium score is
Right.
important. And then your triglyceride to HDL ratio. If your triglyceride to HDL ratio is under 2, your risk of cardiovascular disease is pretty much none. My cholesterol, I'm more carnivore now. That works the best for me. I do eat vegetables and stuff, so maybe I'm more ketovore is what they would call it. And my cholesterol was 400 when I got it checked last time. My triglyceride to HDL ratio was like 0.7.
Wow.
And my cholesterol to HDL ratio was great too, because my HDL is good. And I thought it was going to be a big fight with the doctor, right? I'm like, I'm going for my physical, and I'm like all ready. I'm like, okay. You guys have to get the book, The Great Cholesterol Myth.
That's good.
Mind-blowing.
That's good.
Written by cardiologists too. But I told her, I said, listen, I go, since I've done this, my IBS is gone, my energy's through the roof. I don't have my mood fluctuating every month, which was happening. No joint pain, nothing. And she's like, well, tell me more about this. And she goes,
that's good.
Yeah. And so she was totally fine with it.
And that's good. And that, that works for you. And I feel like, we aren't cookie cutter.
Well, no, that's what the genetics says. Not everybody would.
Right.
But my point is that it's more the ratio and getting all the levels tested.
There's a lot of factors. It's not just like, this is your number, you should go on a statin. Because our brain needs cholesterol, our whole body needs cholesterol. And so it's not, that isn't the only...
We need it for hormones.
We do. And another thing that bioidentical hormone replacement helps with is your cholesterol numbers go down from doing that as well, because it's supporting. So it all is amazing, looking together.
Yeah.
So
a couple of comments on
sure.
cholesterol and calcium scoring. So calcium scoring is a CT scan. The nature of the CT scan is it's very limited radiation. If one were to go for a CT of the abdomen and pelvis, that's about 1,000 times the radiation associated with this particular CT for calcium scoring. And what I've been explaining to everyone for years is the CT for calcium scoring is really precision medicine. The lipid profile, even just the cholesterol to HDL ratio, going back to the Framingham study in terms of population statistics, is valuable, but that's population statistics. For an individual, we know it's particle size, it's LP little a, it's HSCRP, it's homocysteine, it's toxic metals, it's so many things. But this CT scan is a way of basically determining, based on all those factors, how much or little risk an individual is at. But it goes both ways. Fairly recently, I had a woman in her 60s who didn't have significant risk factors, and her CT calcium score was over 600, which is real worrisome. So in that situation, well, I'm still not sure how much of the benefit of statins is from cholesterol lowering versus anti-inflammation.
Sure.
We do have definitive data in people with heart disease, and that, I believe, translates to people with very high CT calcium scores, that statins can be life-saving.
Sure.
So this particular person, and she agreed, I said, there's lots of people who come for a second opinion, like you, where I said, I feel very strong you don't need it, but there's other people who come for a second opinion, and I say, I agree with your comment.
Although I have a side note on that. So there are studies that show that when they gave people with high cholesterol statins, they followed them over 7 years. They did this. They scanned their arteries for plaque over the years. Their cholesterol was normalized, but it did not remove any plaque. There's so many studies showing that statins will change the numbers, but they do not reduce the risk of cardiovascular disease. What reduces the risk of cardiovascular disease is diet, lifestyle, and environment. Some people are at a higher risk for cardiovascular disease, high homocysteine, that's all on the genetic testing too. And it's from inflammation. When our arteries get inflamed, then that sends out, and damaged from refined carbs, too many refined carbs, sugar, chronic stress. There's so many people, you can eat the healthiest diet. I tell my clients this all the time. But if you're chronically stressed, we're designed to handle episodic moments. But if it's like morning to night, you're just like one stress ball. That is just as bad as eating at McDonald's every day. You have to, and that's where like mindfulness and meditation and like really doing the work, loving yourself. And there's so many things involved in being healthy than just what you put on your plate or the supplement you take. So
That's a good point.
The other thing that's huge in our society is social isolation. The
Yes.
prior Surgeon General stated, based on data, that social isolation, which is subjective, is equivalent to smoking. I think that it's 3/4 of a pack a day. So there's a lot in terms of statins and cardiovascular risk reduction. There's conflicting data.
Sure, of course.
As there almost always is. There's
yes.
conflicting data in terms of how people interpret the studies.
Sure.
I mean, there's a lot of studies. It's like they basically say that maybe 1%, and then the only people that it seems to help are people that have already had a cardiovascular event, already had a heart attack.
Right.
But for people that haven't, it does not decrease their risk. And now they're starting to say that since these studies were done on men, that women should never take statins.
Well, and that is, I think, overall, most of the studies are more done on men than women.
They are.
So I feel like that's very hard to get accurate because you've got a completely different hormone profile in men and women and how everything is related. So
I mean, this is like what I do all day long. Is
yeah,
I study,
that's a very interesting point.
Research like newer studies. I research because it's this whole low fat thing was such a farce, and it killed everybody, like literally.
Yeah. That's
when cardiovascular disease and cancers and everything started to go on the rise. Was the launch of the demonizing fats.
Because healthy fats are important. Yeah,
unbelievably important. We need
healthy fats are important, but nobody, I don't think, has our arms around this, but it does tie in with genetic testing.
Sure.
That we do have different biotypes. So I'm totally with you that this low-fat craze from a population standpoint, in hindsight, has been a disaster. But I've recently been reading about ApoE alleles, ApoE2, E3, and E4 for risk of Alzheimer's and heart disease.
Right.
And there is some data that I think is good that for those who are ApoE4 with a high risk, that in those people a low-fat diet does seem to be beneficial. And that to me ties in with the Ornish diet and the published research 30 years ago of Dean Ornish with the low-fat diet. But conversely, those with ApoE3, the data would indicate that a higher fat diet is much better. So it does tie in part with the genetics in terms of what diet is going to be best.
So there's conflicting information on that as well. Because there's so some people are genetically sensitive to saturated fats, where they'd be more inflammatory, but they would benefit even with ApoE4, with olive oil, omega-3, so high, fatty fish, nuts and seeds, avocados, those like a Mediterranean way of eating. And that's a high fat. It's not like a keto,
right?
But it has a lot of healthy fats in it, and we need those fats for our cognitive health. They're calling Alzheimer's now type 3 diabetes because it's from a diet high in, just like you get the plaque in your arteries from refined carbs and sugar, seed oils, that's another one. It's like so many, I think seed oils are one of the biggest problems today as well, because when they take, things like canola oil, soybean oil, cottonseed oil, the vegetable oils, they have to go through a high heat chemical process to extract those oils. So they're already oxidized, damaged fats. So that's like us eating rancid fats.
Right.
And when we eat rancid fats, that causes oxidation in our body. Oxidation causes free radicals. Free radicals steals a healthy electron from a healthy molecule. Too many free radicals lead to disease, anywhere from just joint pain all the way up to cancer. So those are huge. And then all the toxins in our environment, the pesticides, the herbicides, and you could go crazy. It's like I always tell my clients, just do the best that you can. God designed our bodies to detox.
Right.
So we need to give it the right fuel.
Aware.
But we need to be aware.
Awareness is key.
Yeah.
When trying to make the best choices.
Right.
In
Exactly.
what we're putting.
When you can.
Right.
Yeah.
Yeah. And I had a list of questions, but I said this may just go organically. So if anyone has a question, feel free to post it. But for yourselves, like, was there a point in your career which made you feel that this route, that led you into this more holistic route? And I'll ask Sandy first. And yes.
Yeah, for me, it was in 1990 or 1991, of all places in the AMA weekly medical newspaper, I read a full-page article on Dr. Andrew Weil, who at the time was a giant, and was just fascinated and read his book at that time. I think it was called The Natural Mind, maybe it was called Natural Health, Natural Medicine, and was just really intrigued and read more and more and started studying with him. And then just a neat side story is when he came out with spontaneous healing in 1995, which was when he really hit the big time. I had contacted Bistro Bookers, which still exists as a literary club, and said I'd love to do a book review. And they had me in a venue that accommodated a lot of people, and I was an unknown name. This is 30 years ago. I was an unknown name in Buffalo. They had people lined up outside the door. It wasn't for me. It was that so many people were intrigued by spontaneous healing and Dr. Andrew Weil that they literally couldn't fit all the people that wanted to hear this book review in the place. But that's what set me on my path.
Awesome.
And just very quickly, in that first book I read, he talks about nutrition. And he says, in terms of some of the things that we disagree on, where there's controversy, he says, you go back to ancient India and ancient China and ancient Japan. And in one place, white rice is good and brown rice is bad, and in the other culture, it's the reverse. And the same thing with fermented dairy. So lots and lots of controversies. And again, I think a lot of that comes down to biochemical individuality, but in part it comes down to toxins. Like with the oils, is it really the oils, or is it the heat that's being used, or the toxins in the oil, or that they're being stored, in light-colored containers in vegetable oils, at room temperature? So lots and lots of factors.
Right.
Nutrition is complicated.
Yeah. No, it definitely is, and it's not one size fits all. And I think we've been kind of like this. We're kind of tunneled into this is what you should follow, but I mean, you found your own routine for you that works for me,
and genetically it aligns with my genetics. The genetic test actually, the newer one now, I mean, it's been around for a little bit, but it gets that specific, like whether a Mediterranean diet would be best for you, whether a hunter-gatherer diet, whether you could do a keto diet based on your genetics. And there's even a DASH diet on there because some people it shows genetic predisposition to high blood pressure. So it gets that specific, where are you sensitive to refined carbs? Are you, how does your body potentially process fats? Would you benefit from a lower carb way of eating? Or would you benefit from a diet high in complex carbs, vegetables, fruits, that kind of thing? So it's pretty fascinating.
That's great.
Yeah.
What about I know, like in our own family, both Serena and Daria have issues with gluten. Is that something that what are the indicators on the test for gluten?
There's several genes that can cause that can predispose you to gluten sensitivity and an increased risk of celiac disease and inflammatory bowel disease. So there's several of those on there. And then, on the side note, if somebody has MTHFR variants, people with MTHFR cannot convert synthetic folic acid into a usable form of folate called methylfolate. So our body takes folate from food and turns it into methylfolate, so it can be used for many biochemical processes. MTHFR, there's so many genes in the methylation pathway, but that's our master methylation gene, so that's considered like one of the most important, because if that gene is not functioning, what other genes? So we need to make sure the person's methylating. It's our phase 1, you can't detox unless you're methylating. So all wheat in the United States is fortified with synthetic folic acid. So I have clients that aren't genetically sensitive to wheat or gluten, but they have a homozygous variant in MTHFR. So I tell them, I'm like, listen, would be best to avoid modern wheat. Like you can look for ancient grains or some organic products don't have folic acid. Anything imported from Italy or Europe usually is not fortified. But the problem with it is not only can you not convert it if you have MTHFR, it actually can mask a B12 deficiency and it can block folate receptors. So now when you do eat your leafy greens and your eggs and your veggies, folate can't get into the cell. And depending on which variant you have, and if it's expressing, it changes your dietary conversion. It limits your dietary conversion of the folate from food into methylfolate. So, like, I have the worst one. So, yay me.
Oh, no.
So it's up to a 70% loss of the conversion of dietary folate into methylfolate, meaning I could have this big, beautiful salad and nuts and seeds that are huge folate-rich meal, and up to 70% of the folate in that meal, my body's not even using. So if I can't convert that folate into methylfolate so that it can do the methylation processing, then I can have, because MTHFR is responsible for neurotransmitter production, detoxification of toxins and homocysteine, and also white blood cell count, red blood cell count, platelet formation and maturation. It just has so many functions.
Right.
So it has to be clean, but we can clean it up. We can't change it, but we can clean up.
And when you're aware of it, then you can work on making sure that, right. And that's something that, again, I've gone to doctors and they don't know what that is.
Right.
They have no idea, and so I feel like that's a huge thing, and it's a very large part of the population.
Huge.
And so, I mean, this I think is a really important thing. I know that was really helpful for myself.
And here's the thing too. It's like people they'll get one test. They'll get, I got MTHFR.
And they don't know all the. Right.
But I've had people that do not have variants. I've only, in the 8 years I've been doing this, maybe a handful of people that don't have a variant in MTHFR, but they have variants in the other folate receptors. So like DHF, DHFR, there's FOLRH1, there's that can cause issues with folate absorption in the gut. It can also, like the DHFR, if people are consuming folic acid, it actually binds to it reduces folate levels. So even though they don't mind, because people will be like, oh, I don't have MTHFR, I don't have a problem with folic acid.
But
there's other genes. So that's why I'm like, you would be better off doing a complete genetic test so that you know the entire pathway than just, because before I did genetic testing, I went to the doctor to get tested for MTHFR, and insurance didn't pay for it, and it cost me almost $400. And you can get over 200 gene SNPs, like if you got the Works panel from MaxGen, for $349.
Right,
and you're getting an entire picture, your diet, lifestyle, and fitness.
Right.
So it even has like what's the best exercise for you based on your genetics, injury, prevention. It's amazing.
I definitely think it's a great to have that snapshot of all the parts. Yeah.
So coming back to gluten.
Yes.
Above and beyond genetic predisposition, above and beyond celiac disease, which is based on blood tests or biopsy, a significant percentage of the population, it's actually estimated at a third, and it ties in with a molecule called zonulin, has significant gluten sensitivity. Even though the blood tests, including gliadin antibody, are fine, even though there's no genetic predisposition. So again, so much of this comes down to trial and error. So and conventional medicine has recognized this for quite some time.
And what is that called again?
It's just
zonulin.
So is that something it's done? It would be in a blood test or in a genetic test, or?
Well, my approach is again, I do a lot of empiricism.
Yes.
I'm not sure about the answer to zonulin in a blood test. I put people on a gluten-free diet,
and
if it makes a difference,
then it worked.
Yeah, and though a number of Americans go to Europe and find that they can tolerate gluten.
Yes.
Now, is it the selective breeding?
It's
with
the
more
hybridization.
Gluten? Well, I think it might be the glyphosate too in terms of the Roundup. It might be. I'm skeptical. It might be the fortification
it could,
with the folate. And just very briefly to share a really interesting story. The founder of the American Board of Integrative Holistic Medicine, who's deceased now, developed debilitating gluten sensitivity in his 70s. Wow. He was at a national meeting and with others and declined the roll at dinner and told them he had developed this. And this was a physician couple. They said, would you like to do a past life regression? He did a past life regression, identified a traumatic experience in the Middle Ages, and from that day forward he was able to eat gluten again. And
Wow.
until age 72, he had no problems with
Oh my
gluten.
gosh.
So
I totally believe in past life things that affect us now. So that's really interesting.
The
Yeah.
thing about the wheat I did want to add is that all wheat in the United States is hybridized.
It is,
so it
yeah.
might even the organic. So it can say non-GMO organic, which is true. Hybridization is actually a different. So they play with the
The
words.
genetic change. And,
What they did was they took different forms of wheat that would never cross-pollinize in nature, and they created a wheat in a lab that could sustain drought and flood, and we're going to feed the world. Sounds great in theory. But when they did that, they created all these new odd proteins that were never found in wheat before.
Okay.
Our body can't break it down. If our body doesn't recognize it, it doesn't break it down.
Makes
So
sense.
from my studies, and I watched a video on it where they showed somebody's GI tract. We have this lining in our GI tract that it's the only thing that's supposed to permeate it, it's semi-permeable, is our micronutrients, vitamins and minerals. But what happens when we have chronic stress, we eat a crap food diet, medications, it can cause damage to that gut lining, and we get little tiny perforated holes, and that's called leaky gut or increased
right.
intestinal permeability. When that happens, then when we eat food, particles, proteins of food can get into the bloodstream, and it's not supposed to be there.
Right.
So it causes an immune response. Our body's like, what is that? And now you can, later on in life, you can start reacting to foods that you never reacted to
got it.
before,
Okay.
especially when you're eating them all the time. Like, because you're eating it a lot, so you can become sensitive to things you weren't sensitive to before. So like healing the gut, many times you can go back to eating those foods without issue. But the thing about that gliadin protein in wheat, in this modern wheat that's been hybridized, is they had a video where they had a camera in the person's gut and you could see their nice tight junctions. And then they consumed modern wheat. And within 5 minutes, you could see the junctions open up.
Wow.
And now the blessing is God made our bodies to heal. So that the cells are turning over all the time. GI tract, the cells turn over every 5 to 7 days. But it's been shown that it depends on the person's genetics, that every time that we eat modern wheat, it causes leaky gut for up to like 5 to 7 days. So that's one problem. The glyphosate, the pesticides, that's another one. And on the genetic test actually shows if you were genetically predisposed to a higher sensitivity
Right. I think mine
to
did,
glyphosate and pesticides.
Right.
So yeah, and this is another reason why, there's some children will get vaccines and they seem okay, and then other ones will get vaccines and they can have severe issues after, they're dosing these poor children with 4 to 6 vaccines at a time. Some people genetically are predisposed to low glutathione, which is our body's most potent antioxidant. Like, we need that to detox along with methylation. So they could have MTHFR, low glutathione, which helps detox from heavy metals and who knows what's in those things. And you can have a toxic response to acetaminophen or Tylenol.
Oh, yeah, I have heard that.
Yeah, and that's on the test as well.
Oh, that's good.
So if you have a genetic predisposition to a toxic response to Tylenol, and especially if you have low glutathione, then you take, and this is what happens, that you get a fever, you have low glutathione already, you're sick, you take Tylenol. What it does is it has a toxic response on the liver. It lowers glutathione even further. And so it can damage the liver. And
wow.
yeah, so
those are all markers that can be shown
on the test. Like, honestly, I went from working with people for months on end to literally a couple of appointments.
Because they can see
Because
everything.
we have everything we need.
That's
it gives
great.
you a blueprint
That's
to your
great.
optimal health.
That's
It's
great.
amazing.
Yes.
On the topic of vaccines, and I
Yes.
will say I am generally pro-vaccine,
Sure.
but I want to talk for a moment about a fascinating article hypothesis that I read that made so much sense to me. And that was along the lines of glutathione, and Tylenol depletes glutathione.
Yeah.
Right.
The article was hypothesizing and citing 30-some lines of evidence to support this hypothesis that in many people who do have problems, it's not the vaccine per se, it's the Tylenol that's administered afterwards.
Oh.
And so several of the lines.
With the glutathione deficiency
Yes,
especially.
and
that's exactly what I was getting
that
at.
makes
That's
so
been
much sense because you're always told to give Tylenol.
Yeah.
Right.
So several lines were that
Wow.
autism has skyrocketed with the switch from aspirin to Tylenol. Well, there was a good reason in terms of Rye syndrome 40 years ago. Another line of evidence is that in Cuba, where Tylenol is a prescription medicine, there's very little autism. Now, again, these are not cause and effect, but
it's
autism is more common in males. Many males get circumcised at a few days of life, and Tylenol is given. So that the message of this are, and it's not everybody with Tylenol.
No, but
the article was it's people with a neuroinflammatory state in the brain, with genetic predisposition to glutathione issues. But it was a fascinating hypothesis. And to me, the take home was, don't administer Tylenol after an immunization.
Yeah, and if moms can do the testing before they get into, because you can do this is just a simple cheek swab.
Yeah.
So we've done infants up to adults. So if you can do it,
that's great.
Before you decide, which way to go. And when obviously I support my clients in whatever they decide. So I have a whole handout on how to detox your child from vaccines, and also if they can find a pediatrician that spaces them out. Now, I didn't want this to get about vaccines, but I'm just saying, like, spacing it out, detoxing it, and supporting the body so that it can, handle it.
Of course, right. Yeah, that's good. No, those are all.
Is ibuprofen different?
That's different than
things the same way?
Yeah, so the problem with ibuprofen, and that's what I will tell people if you need to take something, is that it can damage the gut. But there's been studies that show that, like, first of all, I always tell them, do not take it on an empty stomach. Take it with protein, especially, because glutamine, which is an amino acid found in high protein foods, it's very high in, like, bone broth. That's why bone broth is so healing to the gut, along with the collagen. But glutamine helps with cellular turnover in the gut faster because it's the most predominant amino acid in the gut. But if you take a glutamine supplement like 15, 20 minutes before taking ibuprofen, it has been shown to help prevent damage to the gut lining.
That's good to know. That is good to know. I don't think anyone's ever said that. That's helpful.
Zinc carnosine is another supplement that protects
That's
the
a
gut.
good gut healing.
I think possibly a more direct response to your question is ibuprofen, naproxen, diclofenac are what's called non-steroidal anti-inflammatories. Those are all sister medications in terms of pharmacology to aspirin. Aspirin irreversibly inhibits platelets. These reversibly inhibit platelets. But those are all sister medications to aspirin. Whether or not any of them are associated with Rye syndrome in young children, I honestly don't know. The association is with aspirin. But those are all more related to aspirin than to acetaminophen biochemically.
That's so interesting. Again, these are things that, I think it's great to have these conversations and learn about this stuff.
Wait, I have another question.
Yes.
So, since, with what you guys said about gluten, would you recommend, anyone, would benefit from a gluten-free diet, no matter what their genetic disposition is?
I think at least the modern wheat that's hybridized and fortified, definitely. And again, you can, I do food sensitivity testing. It's a finger prick. It tests zonulin. Zonulin is it's an indicator of leaky gut and can be caused by gluten. But listen to your body. I mean, that's a big takeaway. One of the things that you had said on there, it's I can't tell you how many people come to me and, some don't know because they didn't want to give it up. But I'm like, let's just do a trial. Honestly, if you're on the right path, within 2 weeks you'll notice a difference. Are you healed? No.
We stopped eating gluten a few years ago, and
but I tell
it's
all
so
the
much
time
better. I feel
that
better.
Really, even people that aren't allergic to it, I really think that
you feel better.
Yes, everyone would benefit from it.
No, I don't agree
in
with
some way.
Yeah,
I definitely agree with you that they'll benefit.
He's got his own. Let's see what.
I don't. Based on an article I read by Dr. Joseph Pizzorno, who founded the Bastyr School of Naturopathy, and this was years ago, and he talks about zonulin. The best available data that he cited in this editorial is that a third of the population has no problem with gluten. A third of the population will
we're
have
just talking
symptoms.
about modern wheat.
Oh.
I'm not talking about, she's talking about modern wheat. What I'm saying is there's people that, I don't think modern wheat, what they've done to the wheat is good for anyone based on the studies that I have seen, the research, the videos that I learned about.
I think, I mean, just knowing people like my clients and, talking, I think that there are people who are very healthy and they eat it and they don't have any
I'm one of
issues.
those.
And so I
I'm one
feel
of
like
those
there are a good amount of people who don't have any, I mean, if they were having health issues, then I think that they definitely should stop. But if you don't, like, I know a lot of people who don't have any problem and they don't have any kind of symptoms of anything. So, and that even going to, like, I know when Serena went to Europe, when she studied abroad, she was able to eat
I hear that all the time.
In Europe.
Same thing with me. We went to Aruba, and because I don't eat wheat here, I don't eat grains usually, but we were on vacation, and they source their wheat from the Netherlands, and they don't genetically engineer it. So I'm like, well, I'm going to try it. It was a sourdough, panini type thing, and I had no issues with it either. So I definitely think that if people are concerned, if they're having any symptoms,
but if you have symptoms,
you
I
would
think
have
it's a good
definitely
thing to
benefit
try.
to take that out. And it could be anything from, it doesn't have to be physical. You could have brain fog. You could have depression, anxiety. I have clients that the gluten was causing anxiety. So it's everything's connected. Our neurotransmitters are created in the gut to be used by the brain. They're not created in the brain. So when we have depression and anxiety, it's not a brain issue, it's a gut issue.
Right. Yeah, and I think people don't often realize.
So because I've had people say that, well, it doesn't bother me. I don't get I don't have stomach issues. No, but you have arthritis. No, but you have this. You have, you're not sleeping. You have heart palpitations, heart racing, because food sensitivities will also raise your heart rate. People don't realize that either.
Right.
Yeah, so on the one hand, when it comes to grains, on the one hand, there are some people, I think this is a distinct minority, who through trial and error are sensitive to virtually all grains. There are people, it sounds like you might be one of them, who feel best with very little grains. But my advice, even for someone like myself, where I'm pretty sure I could eat gluten until the cows come home and I wouldn't feel bad, but that's not healthy. Everything is balanced in terms of optimum nutrition. So even for somebody who's got no symptoms, it makes sense to me, to eat, steel cut oats, to eat quinoa, to eat buckwheat, which is a totally different grain from wheat, even despite the name. So and population data indicates that plentiful consumption of whole grains at a population level is associated with better health outcomes. Whole grains are a fundamental tenet of the Mediterranean diet. But there are people who completely cut out grains, and I've had this with patients, and they feel better. And in that situation, I tell them, you can live life without grains, for sure. Right.
And again, it's good to be able to, sit with someone and look at what they're doing and say, let's try this, and being supportive of what works for them. I feel that's great.
Right, and that's why I said, listen to your body, and if you're not sure, you can do food sensitivity testing, which is completely different than allergy testing. Sensitivity is a completely different mechanism, but it's free to do an elimination. Just take it out for 4 weeks minimum, and then if your symptoms are improved, then if you removed several things, you add them one at a time, at one meal, one time a day, up to a week. If you're fine after a week, then usually you're okay with that food. Then you can test the next food.
Right. I mean, it's work. No one's saying that this is an easy thing, but
that's where the genetic testing takes the guesswork
to say okay, maybe we want to look at this, but this is I feel like people want sometimes an easy fix. And they simply cleaning up their diet and or just, even adding some good things or taking a few bad things out. Starting small and making those changes
100%
is such a big,
and every small change can make a huge difference. And so the hope is that because I have clients that are like, oh, they're 180, they can switch everything. And then I've got other ones that, we're taking baby steps.
Right.
But every step that they take and they notice an improvement, it encourages them to make the next step. So you make one change at a time till that becomes a habit. Whether it's you don't drink enough water, just start with drinking enough water.
Yeah. That's
Filtered
huge.
water. And then once you've got that as a habit, you get yourself a pretty water bottle, glass, or stainless steel. Carry it around with you. Put some like lemon in there, whatever, to make it more palatable if you need to. And then once you have that as a habit, then the next habit, whatever it is. And you can even swap out. I've had it where I swapped out like unhealthy type foods. I don't like to demonize food, but like not great choices for a better choice. We just do it that way slowly.
Yeah.
And it's.
Because I feel like when you do small steps, then you do get encouraged, and you do that little bit of feeling better. Does you're like, okay, I can do it. Because I have people that come to me, they want to work on things, maybe spiritually, and they want to do everything at once, and I'm like, just do one thing at a time. Just do one thing, and it makes it so much easier. Yeah.
With lemon and water, ideally organic.
Yeah.
With lemon juice, ideally organic.
Yeah. I have an Alkalife water filter system, and it is ionized, alkalized, purified water. And so you can change the pH.
Oh.
So you can do between 8.5 and 10.5. 10.5 would be to like soak rice or something. I usually drink around 9.
Yeah.
But it's amazing. We have an ice maker, and we make all our ice with
I
it.
think there's also a regular option because it just
You can have just purified water too, but
and then
it's
there's
amazing.
the lower ones for if
The
you
lower
have
ones, so the low, like the acidic, so you can use that to, rinse, like for rinsing your face and things like that.
Cool.
Yeah, it's pretty cool.
So alkaline water, I went to a demo years ago. I was really impressed. I've heard these dramatic anecdotes like I'm hearing right now. I've already mentioned Dr. Joseph Pizzorno, the founder of Bastyr School of Naturopathy. He's in his 70s, maybe his 80s. He still continues to write and to research. I asked a question in a presentation when he was talking about the importance of an alkaline diet and tissue pH. I said, what about alkaline water? And his response was, looking at the gold standard of 24-hour urine for pH, his response was that an alkaline diet makes a difference, that as best we can measure biochemically, that alkaline water doesn't make a difference.
Doesn't make a difference, right. I don't know that, that I feel, I like the ionization of it, and I feel like that makes it's supposed to make it like more, like people can drink a lot of water and still be dehydrated, right? So it has to do with
I have those
better hydration.
the little oxygenated tablets or whatever, you put it in your water and it it does something.
Ionized water,
ionized or whatever.
Yeah, ionized, I think, has to do in part with negative charges, and I can't remember if it's negative or positive, but there's a physiologic basis of this feeling good when we're around waterfalls or when it rains, and it has to do with the ionized water in nature.
Yeah.
But for people that, there are people that drink and feel dehydrated all the time. Many of them, I believe, have adrenal dysfunction, or what's sometimes called adrenal fatigue.
Yes.
And again, trial and error, many of those people feel better taking electrolytes.
Well, I was going to say, especially if we're
electrolyte,
filtering our water.
Right.
So there's not that tap water would be helpful anyway, but like when we filter, like I have an RO system at home, so it takes everything out.
Yeah, so
there's
for
literally
those of you who don't know, the reverse osmosis does take out the fluoride. This does as well. Okay. And that's why I like
takes out the
this.
fluoride and all
the minerals.
Microminerals.
Yes. So
not that there's much in our water because of what they've done to it, but in our soil. So electrolyte drops can be very beneficial as well. In fact, I just got, there's a company that I'm using. They sent me some samples. It's called Buoy.
Oh, I've heard
BU.
Serena bought that.
So they have hydration drops. They also have digestion drops that are plus hydration. So it's got like some ginger and some things like that. And literally, like this little bottle, I just do one. It's just like a tiny squirt into your water bottle, and that's all you need.
That's
you
good.
get like 40 servings out of that. So I've been using that because the other thing you can do is, if anyone's heard of this, is Soleil water, which is basically you just take a natural salt like pink Himalayan salt or Celtic sea salt, and you take like a cup of it and you put it in a mason jar, fill it with your filtered water, give it a little shake, let it sit overnight, and then the water becomes totally saturated with the natural salt, which those salts have approximately 84 minerals in them. And then you don't touch the salt. There should be some salt at the bottom so that you know that's totally saturated. Then you just take a teaspoon of the salt water and you put it in a glass of water and drink it. And that, I've had many clients do that, and that's inexpensive. And you don't ever have to, because salt is a natural preservative, you don't ever have to change it. Just as the water goes down, you just add more salt, more water. And so I'll put a teaspoon of that in my coffee in the morning. So then, you know, it also helps alkalize the coffee too as well.
Yes.
So
Well,
it's acidic.
that is one thing I do. So the number 10 alkali for the coffee makes the coffee
Smooth.
Yes. So like just takes the acidity down. So I do like that.
Yeah, so the Soleil water does the same thing, or you can even
interesting.
put your pink salt in your grounds. Some people put it in the coffee grounds.
Yeah.
On the topic of minerals
Yes.
in water, there is fascinating and extensive published data on lithium that's naturally present in water. And the data, and James Greenblatt, a giant in the field of integrative psychiatry, wrote a book on lithium a number of years ago. The data is that when you look at populations, that the level of lithium in drinking water is associated with significant decreases in homicides, in prison populations, and suicide. So in very, very small doses, there's what I consider to be provocative, very suggestive data that lithium in small doses, whether in the water or taking a lithium orotate 5 milligram pill, daily or a few days a week, it seems to protect against a whole range of neurodegenerative conditions, Alzheimer's disease, Parkinson's disease, ALS, and again, from what I've read, I'd actually love to see lithium in small doses, as a public health measure administered to prison populations. This is not to be confused with lithium carbonate, which can be life-saving, but which is a pharmacologic or even an industrial dose as opposed to a physiologic dose.
So lithium orotate, that's also on the test, because it can help. So there's another gene that can cause low levels of cerebral folate levels, or folate in the brain. And so it's been shown that if people have this gene variant, it contributes to depression. And that lithium orotate actually helps with the methylation cycle and getting more folate into the brain.
Amazing.
So that's how it helps with that. And it also does, there is studies showing that it does help with Alzheimer's. The other thing, gosh, I could talk about everything with
It's amazing.
With choline, phosphatidylcholine. The test will show if you're genetically predisposed to low phosphatidylcholine levels. So choline, or phosphatidylcholine, PC, is also part of the methylation pathway, and low levels have been shown to increase the severity of ADHD, autism, and Alzheimer's.
Wow.
And it also plays a role in non-alcoholic fatty liver disease because it's a phospholipid, and those phospholipids, they break down fats. So it also helps lower cholesterol. So it lowers cholesterol, helps prevent fatty liver by breaking down fats. And it also is the precursor to acetylcholine, which is the major neurotransmitter in the brain.
Wow.
So it helps with cognitive function, all things like that. And again, like some people genetically, I mean, we can still be low in it.
Sure.
But the richest source of phosphatidylcholine or choline are egg yolks. So if people are eating egg yolks daily or eggs daily, they, probably are getting enough. Also beef liver. I'm a big believer in taking like desiccated beef liver capsules. It's like nature's multivitamin.
Wow.
You get CoQ10, same thing with heart. Like beef heart.
Yeah.
And you can get, from organic grass-fed cows from like New Zealand and stuff like that. So that's an option too. But
fascinating.
so there's so many things we can do with diet and even supplements if needed, and
So neat.
we get the answers.
Wow.
It's crazy.
That's great.
That's amazing.
I'm gonna just check if there's any questions. No, but thank you all for watching.
I
So,
do need to
yeah.
wrap up in a few
Oh
minutes. I
yeah,
have a
yeah.
super hard stop.
So well, if I one of the questions I know was if you could give one piece of advice, like one thing that you would just recommend across the board, you know, to get someone started, like what would your one thing that you would say to someone, like if they could do one thing to you know, tomorrow or today?
For me, well, it would be two things.
Yes.
Exercise and take vitamin D in modest doses in the winter months in northern climates. That would be the two things I would recommend. Years ago, when I taught a selective to medical students on alternative and complementary medicine, as it was called at the time, we had a physical therapist who's now a physician assistant come in, and when she said, I love this, she said, if exercise was a pill, everyone would take it.
That's true. That's true. Yes. And you?
Yeah, so I mean, just a side note on the
Yeah.
vitamin D, we need sufficient magnesium to activate vitamin D and also to get calcium into the cell. So if I was going to say a supplement, which I wouldn't, but well, I mean, I would. But if supplement, I'd say magnesium and probiotics or fermented foods are extremely important for gut health. Magnesium, because of what they've done to our soil erosion. When they studied the nutrients, the minerals, and vitamins in food today, magnesium took the biggest hit. So even if you eat a diet high in vegetables and nuts and seeds, it's estimated that over 85% of our population is deficient in magnesium, and it's needed for over 300 enzymatic reactions in the body. Like I said, we can't convert vitamin D into its active form, and we cannot get calcium into the cell. So if you're eating a lot of dairy and calcium-rich foods, leafy greens, and you don't have sufficient magnesium, it can actually contribute to arteriosclerosis.
Wow.
It's magnesium deficiency can cause insomnia, acid reflux, fibromyalgia, gut issues, PMS, depression. There's so many functions for magnesium. So that's like everyone feels better taking magnesium. That's my big takeaway. And just make sure you watch the form. So magnesium glycinate is awesome for relaxation, muscle pain, and also heart health. That's magnesium glycinate. Magnesium malate is great for like fibromyalgia and energy. And then there's citrate that is has a high bioavailability, but it has a slight stool softening effect, so that's good for people with constipation. And then there's threonate, which that one crosses the blood-brain barrier the best, really good for anxiety and racing mind, ADHD, sleep issues. They all will help with sleep. They all will help with relaxation. But glycinate, malate, and threonate do not have stimulating effects on the gut. Citrate does. You want to avoid oxide unless you're just looking to clean your bowels, because we just only absorb like 12% of it. So it's a great intestinal cleanser, but it doesn't fix a deficiency.
Anything.
Yeah.
Well, this was very fascinating, and I want to thank you so much both for coming and talking today. And I will be putting contact information in the comments. So for anyone who would like to get a genetic testing, Debbie can help you, give you the information for that. And if someone would like to see Dr. Levy, I'll put his contact info for you to reach out to schedule. But yeah, thank you. We're also thinking maybe in the fall that maybe we're planning a health talk. So if anyone is interested, please, write interested, and we'll keep your name there and contact to you. But look forward to that in the future. So thank you all for watching, and have a great day.
Bye-bye.
Bye.